Thank you for your interest in TruKlear, the first fully aesthetic SL bracket by Dent. Both the body and the slider for opening and closing the self-ligating bracket are made entirely of ceramic. The slider of the TruKlear bracket is retained in the open or closed position and prevented from slipping out by a small roller fitted underneath and made of tooth-colored, biocompatible plastic resin. No metal parts are used, which could be visible through the ceramic and thus interfere with aesthetics. Doing without metal also has another advantage. The bracket is absolutely nickel-free and suitable for allergy sufferers. The ceramic compound developed specially by Dent is translucent and adapts to the natural color of teeth. Furthermore, it does not discolor and so provides permanent aesthetics. The locking slider widens towards the slot to facilitate a high level of rotational control. The distance between the slot base and the slider was designed as small as possible. The height is ideal for closely guiding arch wires with a height of 0.025 inches and thus enables good torque transfer. To give optimal torque control, we recommend the early use of rectangular arch wires of this design height, for example 14 by 25 or 16 by 25. TruKlear brackets are equipped with an inverse hook base with an anatomically adapted curvature, developed and patented by Dent. Some 4,000 teeth from around the world were scientifically examined, shapes were analyzed, and the results transferred to the new base design. The inverse hooks of the special base ensure optimal mechanical retention, as well as problem-free debonding after completed treatment. The slots of the TruKlear brackets have 4 contact ribs. The slot inserts of the bracket are optimally rounded. The arch wire is therefore positioned on a maximum of 4 points, even in difficult clinical situations, has greater freedom of play and slides through the slot with only minor friction without binding and notching effects. Prior to positioning, apply adhesive to the bracket. This should be dabbed carefully into the tunnel of the basis from both directions using a brush. The bracket with applied adhesive is then placed diagonal to the gingival edge and pressed down. The excess adhesive is pressed out mesial and distal. The anatomically curved base adapts optimally to the natural form of the tooth crown and enables tilt-free, secure positioning of the bracket. The slider should always be opened using the classical opening tool, which is also used for quick clear. To this purpose, the tip of the tool is inserted vertically into the recess of the slider and pushed to gingival with a linear movement. Before changing the arch wire, please clean the bracket first, as plaque and calculus could otherwise negatively affect opening. As soon as the arch wire is placed, it is pressed down on the slot base using the arch wire guide, and the slider is then gently pushed back with the finger or a suitable instrument. The precisely rounded slot edges of the TruKlear brackets allow using arch wires with tooth-colored coating. Biocosmetic arch wires are recommended to give a perfect aesthetic appearance. These not only offer a high level of patient comfort, as ultra-elastic night-eye arch wires are concealed beneath their white coating, these also ensure long-term aesthetics without discoloration. Please ensure that the biocosmetic arch wires are neither adapted nor bent, as the use of sharp instruments may damage their white coating. Chip-free debonding can be performed in 2 ways. TruKlear brackets are equipped with debonding bevels at the mesial and distal pad edges. This allows the safe use of special debonding pliers, due to an indentation in the tongs of the pliers, also with ligated base. A Paul's tool can also be used, the same as for the ceramic brackets Quick Clear and Glam. This is first positioned securely on the bracket and then removed by tipping to mesial or distal. This is hardly noticed by the patient and the bracket remains undamaged for any required repositioning. Avoid any rotation when using the pulls tool, as this may damage the bracket. The inverse hook base is designed such that the adhesive in the diametrically positioned openings forms small hooks which remain in the bracket during debonding. As a result, the majority of the adhesive remains on the tooth and can be removed without difficulty. The risk of enamel chipping is thus reduced to a minimum. You and your patients will be delighted with the TruKlear bracket. The combination of ceramic body and ceramic slider provides perfect aesthetics without using any metal. The anatomically curved base is characterized by easy positioning and a high level of mechanical retention. Chip-free removal at the end of treatment is possible by using the pulls tool. Allow yourself to be convinced by the TruKlear bracket system and benefit from reduced chairside times, fast successful treatment results and satisfied patients.